Good afternoon, everyone. Welcome and thank you all for tuning in to your Pennsylvania Health Insurance discussion. My name is Paula DeGregory. I'm the chairperson of the Crawford Health Improvement Coalition, known as CHIC, who is hosting this event. And I am proud to represent this nonprofit coalition made up of human service organizations and residents from all across the Northwest region, whose mission it is to promote and facilitate the health and well-being of our communities. As part of that mission, we've invited all Pennsylvanians to join us today to learn more about the new state-based insurance exchange opening in PA, known as Pennie, and to address other health concerns that residents face, particularly those faced by rural and underserved areas. A panel of state insurance and health experts has agreed and gathered to do just that. So we are encouraging all of you to ask questions during this discussion. If you are watching through Zoom, please post your questions in the Q&A. If you're watching on cable, Facebook, or Stream TV, please call 814-758. Note that we will, 758-1919. That's 814-758-1919. Note that we will not be taking questions via Facebook. We will try to get to all of your questions, but if we do not, we will be sure the panel answers them after the discussion, and we'll post them on the Crawford Health Improvement Coalition website at crawfordcountypartnership.org, as seen on your screen. This discussion is being recorded and will be available to view on the CHIC website and aired on Armstrong Cable later. The air dates for Armstrong will also be posted on the CHIC website. Before we begin, I want to take a moment to thank the Pennsylvania Coalition for Oral Health for facilitating this event. We could not have done it without PCOH and the help of Director Helen Hawkey. And now it is my distinct pleasure to introduce you to today's moderator, Dr. Denise Johnson. Dr. Johnson is the Chief Medical Officer of the Meadville Medical Center. Dr. Johnson earned her medical degree at Georgetown University and is board certified in obstetrics and gynecology. A fellow of the American College of Healthcare Executives, she also serves as one of Pennsylvania Governor's Commissioners for Women and is the current board chair of the Meadville Area Free Clinic. Dr. Johnson, thank you for your time and welcome.
Great, thank you so much for that, Paula. Now it's my pleasure to introduce our panelists for the evening. First, Zachary Sherman. Zach Sherman is the Executive Director of the newly established Pennsylvania Health Insurance Exchange Authority. It's a state-affiliated insurance marketplace created to reduce costs and better support the needs of our consumers purchasing health coverage. Zach brings a wealth of experience in health policy and analytics to this role at the authority. Most recently, he served as the Director of HealthSource RI, where he held multiple positions since its establishment in 2011. First as a member of the original implementation team, and then later as the interim Chief Financial Officer and Chief of Staff. Zach has worked in health policy and research since earning his bachelor's degree in business administration from Rhodes College in Memphis, Tennessee. Next, we have David Buono. He has been serving in the insurance industry since 1999. He is a Penn State graduate who began working with the Pennsylvania Insurance Department in 2015 as the department's consumer liaison. In this role, he ensures the department is reaching consumers and providing assistance to those navigating the complex insurance structure. He supports the department's initiatives to keep the state insurance market competitive while focusing on helping consumers learn and understand their rights and responsibilities, what insurance product options are available to them, and provide a place for consumers to get answers to their questions. Next is Helen Hawkey. She's worked in clinical dentistry and served as an oral health advocate across Pennsylvania since 2001. She currently serves as the Executive Director for the PA Coalition on Oral Health, a state and community coalition working across the Commonwealth to improve oral health for all Pennsylvanians. She previously worked as a research coordinator with the Centers for Oral Health Research in Appalachia on a childhood caries study through the University of Pittsburgh. Helen also managed a successful prenatal and pediatric oral health consulting business where she provided education to childcare and dental providers, as well as parents of young children. She has worked as a trainer with the PA Head Start Association and the PA Academy of Pediatrics and Oral Health Programs. Prior to 2013, she worked as a full-time clinician in a family dental practice for 11 years and worked in a public clinic serving families on medical assistance for the year preceding. And Tia Whitaker, she's the statewide director for outreach and enrollment for the Pennsylvania Association of Community Health Centers. She serves as the lead navigator for health center-based inreach, enabling services, outreach, and enrollment. She coordinates education, training, and opportunities for networking to address challenges and identify best practices for the certified application counselors and navigators who are employed by the community health centers and like mission providers in rural and urban underserved areas. Prior to joining the team, she was a manager for member outreach for AmeriHealth Caritas Health Plan in Harrisburg, and she is a vice president of the Central Pennsylvania Coalition United to Fight Cancer. A board member of the Victory Outreach Fellowship Church in Harrisburg and the Danny Lankasot Tackling Success Foundation. She received her associate's degree in human resources and bachelor's degree in business administration from Central Pennsylvania College. We're honored to have such distinguished panelists who are intimately versed in today's topic. I will now ask each of our panelists to spend 3 to 5 minutes just further expanding their roles as it relates to our new Health Insurance Exchange Authority. And we'll begin with Mr. Sherman.
Thank you, Dr. Johnson. Before I jump in, can you just confirm that you hear me?
We do.
That's great. Well, thank you for the introduction, Dr. Johnson. And thanks to the Crawford Health Improvement Coalition, as well as the PA Coalition on Oral Health for pulling us all together to have this important conversation. As Dr. Johnson noted, I am the Executive Director of Pennie, Pennsylvania's new health insurance marketplace. I've been in this role about a year now, and come, as was mentioned, come to this role from the state of Rhode Island, where I was involved in the Affordable Care Act related reform efforts, including running their state-based marketplace for the previous 4 years. I'll tell you a little bit about Pennie, about the organization, about our name, as well as the functions that we play and key milestones that are coming up related to the rollout of our new state marketplace. So starting with the name, it's Pennie. It's derived. It comes from the combination of who we are and what we do. It's the Pennsylvania Insurance Exchange. That's PENNIE. And while that's where the name comes from, we don't actually refer to it as an acronym. It's just Pennie. It's intended to be approachable, an approachable place for people to access affordable coverage and service necessary to navigate what is a complicated process. And related to that, or tying it in, our tagline is connecting Pennsylvanians to health coverage. So, why did the Commonwealth do this? Why did the Commonwealth decide to embrace a state-based marketplace? And I think it had a lot to do with the fact that the Commonwealth is spending a lot of money for use of healthcare.gov and maybe not getting the greatest return on that dollar. So last year, and I know Dave is going to touch on this, but last year the Commonwealth came together and decided there's a better way to do that. We can use the money we're spending on healthcare.gov, invest it in a program to support a state-based marketplace, and we can use the savings derived from that to invest in an affordability program. And that's how this thing came to be, and that's how Pennie was created. So starting this fall, we're fully making the transition from healthcare.gov to a state marketplace, and that's right around the corner. That starts November 1st. So who are we? Just real quick, we will be the official health insurance marketplace for Pennsylvania. We are replacing healthcare.gov. Existing customers currently enrolled through healthcare.gov will be transitioned over to our new platform, to our new program, and we'll very soon here start communicating to them about the transition. a big piece of why a big underlying goal for this transition is to ensure those who are currently enrolled have the ability to transition over to this platform, this new program, and renew in coverage if that's what they desire to do. We will be the only source for financial assistance to help pay for both the cost of coverage as well as care. That's premium tax credits to make your monthly bill more affordable, and cost sharing reductions for those who are eligible to help pay for your copays, your deductibles, your coinsurance. We will help in a number of different ways. We'll have at no cost to consumers, we'll have the ability for people to call into a dedicated call center to provide enrollment assistance, technical assistance, decision support through the process. We'll have online self-service tools. We'll have, through our expanded assister network, in-person assistance to help with the navigation process. Tia is, of course, going to talk more about that. And we will have a group of Pennie certified brokers to help people pick the right plans for their health needs and their budgets. So that's who Pennie is in a nutshell. I'm of course looking forward to this conversation, and we'll answer any questions you might have about the rollout. Dr. Johnson?
Great. Well, thank you. Thank you very much for that introduction to Pennie. We're going to ask Mr. Buono to just expand a little bit on his role in Pennie and the exchange.
Well, thank you, Dr. Johnson. Just want to make sure that everybody can hear me.
Yes.
Perfect. All right. Well, hello. And on behalf of Commissioner Altman, thank you for inviting the Pennsylvania Insurance Department to attend this event again this year. And 2020 has been a year, and there's been some good. So last month, Pennsylvania actually introduced Pennie. So Zach, welcome. And Pennie is the new state-based health insurance marketplace for 2021. It will be available to all Pennsylvanians and aims to improve the accessibility, affordability of individual market health coverage. It's also the only place that connects Pennsylvanians to the financial assistance, just like Zach had mentioned. The insurance department has worked diligently to keep rate increases low for consumers in the individual and small group markets. Last year's enactment of Act 42, which created Pennsylvania's reinsurance program and the state-based exchange, Pennie, have played a significant role in driving individual market premiums down for 2021. In fact, the reinsurance program is the reason individual market rates are decreasing rather than increasing this year. Based on the final approved filings, the reinsurance program's impact will make premiums 5.3% lower than they would have been without the program in place. And that's even a greater impact than the 4.6% decrease that was initially projected. This decrease is really because of the leadership demonstrated by Governor Wolf, as well as our legislative leaders, working together to adopt Act 42, which was a unanimous bipartisan passing. Now, we also continue to stabilize our health insurance market. This year, no counties will be losing on-exchange insurers in the individual market, and 13 counties will see at least one new insurer offering on the exchange. This marks the third year where Pennsylvania is seeing increased competition and decreasing or moderately increasing premiums. And that demonstrates that Pennsylvania's efforts to stabilize and improve affordability in this market have been working. I'm extremely pleased that insurers remain committed to providing ACA coverage options to consumers across the Commonwealth. Now, there have been some challenges this year. COVID-19 has impacted many Pennsylvanians. Some have become ill, some have lost loved ones, some have lost jobs, and some are experiencing the stress of losing a job and their health insurance coverage. The department wants to assure Pennsylvanians that if they lose their employer-sponsored health care coverage because their employment was affected by the COVID-19 outbreak, there are options available to continue coverage, either through the Affordable Care Act marketplace or through medical assistance and the Children's Health Insurance Program, or CHIP, in addition to COBRA. I really want to stress the importance of the individual market. This market exists to be the place that people can go for coverage when they do not have coverage from another source. As Pennsylvanians may potentially lose access to employer coverage, they should explore their options on the marketplace and through medical assistance, both of which will generally be more affordable than COBRA, depending on income. I also want to add a couple of reminders about ACA coverage, which are important to remember. First, more than 80% of Pennsylvanians who are currently enrolled in the marketplace receive financial assistance. As Zach had mentioned earlier, all these Pennsylvanians receive assistance to pay for their monthly premium based on their income, and many also receive assistance to lower out-of-pocket costs like co-pays and deductibles. Second, help is available. Tia is going to be talking about some of the help that she provides, and I have had the privilege of working with Tia over the past couple of years, and they do amazing work. There are navigators and assisters who provide free, unbiased assistance enrolling in coverage. Consumers can visit our website at insurance.pa.gov to get help in their local area, and navigators and assisters are registered by the insurance department. So I also want to touch on the uncertainty surrounding the Affordable Care Act in the coming months, as the Supreme Court is scheduled to hear arguments in a case just after the election. The ACA is imperfect, but it has significantly changed the landscape of healthcare in this country by providing options for millions of Americans, including those most vulnerable and especially those with pre-existing conditions. In the short term, uncertainty over the future of the Affordable Care Act should not deter anyone from getting insured. A ruling from the Supreme Court on the ACA is not expected until May or June, and that assumes the Supreme Court keeps current schedule despite the unfortunate passing of Justice Ruth Bader Ginsburg. By the time that decision comes out, anyone who has enrolled will have a plan, a contract, and coverage for 2021. We must remain vigilant and be vocal about the future implications that a bad ruling could have, but in the meantime, focus on what is most important, protecting yourself and your family by getting and staying covered. We're also watching legislative efforts at the insurance department at both the federal and state level that may assure comprehensive and affordable health care, regardless of what the results of the Supreme Court ruling may be. Our mission is to help Pennsylvanians get coverage they need for themselves and their family, all while assessing the financial aid for which they are eligible to help lower their monthly costs. Pennsylvanians want and deserve access to health coverage, including increased options in the individual market. Governor Wolf and Commissioner Altman recognize this and continue our ongoing commitment to protect and educate consumers while fostering a competitive, solvent insurance market. I want to stress the insurance department is here to help. If any consumers have questions about their insurance or an issue with their insurance, I encourage them to contact us. Our website is insurance.pa.gov, and our coronavirus page that we've set up has information for consumers as well as providers, insurers, and companies. Also, our consumer hotline is still available at 1-877-881-6388. And with that, Dr. Johnson, I will hand it back to you.
Great. Thank you so much for that detailed explanation. This is really going to be helpful to our viewers. I'm going to move on now and ask Mrs. Hawkey to go next.
Yes, thank you very much. And thank you so much to the Crawford Health Improvement Coalition for the invitation and this opportunity. The Pennsylvania Coalition for Oral Health, or PCOH, is a statewide advocacy and community coalition, and we focus on really identifying the problems and the solutions around access to equitable dental care services in our state. Across Pennsylvania, and especially throughout the northern tier of counties in our most rural areas, both children and adults have identified dental care access as a barrier to staying healthy. Oftentimes, the mouth is considered secondary to overall health, and we try to elevate the importance of oral health in staying healthy. Dental insurance has also sort of been considered secondary to health insurance in the past, and we'd like to see an increase in not just the coverage provided in dental health plans, but also an increase in providers working with the specific insurances that Pennsylvanians use the most. So PCOH maintains our focus on the priorities of oral health policy, increasing care for those who are typically underserved, improving the oral health workforce, and then lastly, advocating for public health improvements like community water fluoridation. It may seem somewhat out of place to see an oral health coalition serve on a panel such as this, but oral health is a vital part of overall health. Dental disease is actually the #1 most common chronic disease of our children in Pennsylvania, and it's nearly 100% preventable. So it is our hope that oral health care can be part of all conversations about health and health coverage in the future. And we like to serve, our website and our staff are always a resource for individuals and organizations seeking better access to dental care. So thank you again for this opportunity.
Great, thank you very much. Okay, we'll move on then to Mrs. Whitaker.
Hi, can you hear me? Wonderful. So again, thank you so much, Dr. Johnson, and thank you, Chick, for gathering us all together to talk about these important issues. So again, my name is Tia Whitaker, and I'm the Statewide Director for Outreach and Enrollment at the Pennsylvania Association of Community Health Centers, PAC as we call ourselves. We are Pennsylvania's primary care association, and we represent federally qualified health centers, lookalikes, rural health centers, and other mission-like providers. So Pennsylvania's health centers serve about 900,000 people annually at more than 300 sites with locations in 52 of Pennsylvania's 67 counties. We serve 1 in 14 Pennsylvanians and 1 in 5 individuals on Medicaid or uninsured. Our community health centers offer comprehensive quality primary medical, behavioral, and dental health care. We're distinguished by the characteristics of our fees are based on consumers' ability to pay. We offer quality primary health care that's open to all, and we have highly competent healthcare professional teams and are community controlled. Community health centers serve as medical homes and safety net providers across the state. During periods of insurance or periods of being uninsured, community health centers are ready and willing and able to assist patients and consumers with quality health care and linking them to the security of health coverage. PAC and our community of community health centers has been providing enrollment assistance in the health insurance marketplace since 2013. PAC has been the sole organization in Pennsylvania to be awarded funding to provide enrollment assistance every year since 2013. Our network of over 200 assisters provide free in-person and remote enrollment assistance through fair and accurate and impartial information and services, and we assist consumers in making informed decisions on health coverage options and enrollment. You're fortunate to have Community Health Services, Meadville Medical, and Community Health Net offering services for Crawford County residents. For this upcoming enrollment period, consumers will be able to get information and assistance from trained enrollment assisters. PAC has a list of enrollment assistance locations located on our website at www.pac.org under Need Health Insurance. Thank you so much for this opportunity. Dr. Johnson, back to you.
Great, thank you very much. Thanks to all our panelists. I think it's really exciting to hear all of the work that the assisters are doing and PAC and the work that already has been done. But also very exciting to know that Pennsylvania, the governor, the insurance department, and the legislature have seen the benefit of transitioning to our own exchange so that we could provide more services at a lower cost and really expand what we're able to offer to Pennsylvania. And so really excited to hear about that. I want to ask David to explain to us a little bit about if someone then has been using healthcare.gov and they're transitioning to Pennie, what does that person need to do?
Let me take myself off of mute. For right now, and Zach, this may be something that you can jump in on with the transition between healthcare.gov and Pennie. Is that something that you would like to tackle?
I'd be happy to, sure. Yeah, so we have a we have a large number of Pennsylvanians currently enrolled in marketplace coverage through healthcare.gov, just around 300,000 Pennsylvanians. And our first job as part of this transition is to make sure that they are transitioned over, both through a technical process of getting their account information and their enrollments into our platform, and also from a communications perspective to ensure they understand what's happening there and how they can renew in coverage or come back to the marketplace and shop around for the right plan in their budget for the 2021 plan year. So the process for current customers related to communications is just around the corner. Next week, we're going to start communicating to those customers about the transition. We'll send them, depending on their communication preference, an email or a paper notice explaining to them that this change is coming, that Pennie is the new marketplace. We're going to give them an account claiming code in that communication that will allow them to come in and create their account in Pennie through either online or by calling us or with the help of an assister or a broker to come in and take a look at their account information, as well as their renewal status. They have the ability to renew in coverage if they're able and still eligible. So all of that information is getting ported over. We'll send them a communication. We'll follow up right after that with a renewal communication, as well as information about their eligibility status. So the intent is to tee it up in a way to allow them to do whatever they please, whether it's stay in their plan, if the plan is still available, or shop around. To the extent there are any questions or confusion around that process, customers can give us a call. They can send us an inquiry over online. They can go to one of the over 200 assisters through PAC across the Commonwealth to get information, to get assistance. They can go to a Pennie certified broker with questions about that process. So we've teed it up in a way to allow them to maintain if they'd like, or to change up based on changing circumstances, and have really tried to make sure that the support services are there through whatever channel they like to get assistance. Customers like to get assistance to effectuate that transition as smoothly as possible.
And there's always the chance that one of our consumers will go to healthcare.gov to apply for coverage. And if that happens, we're going to continue to work with our federal partners to ensure that that Pennsylvanians are sent to the right place. If a PA resident goes to healthcare.gov seeking 2021 coverage, they'll be redirected to Pennie. So the federal marketplace's call center and service center will also direct shoppers to Pennie come open enrollment. So we have the great work that Pennie is doing, plus the insurance department or Pennie are working very close with our federal partners to make sure that no one gets lost in this transition. And so far, really excited about seeing what's going to happen.
Wow, that's great to hear. So several of you touched on it, the fact that we've made this transition then from healthcare.gov to Pennie, and there are several benefits to Pennsylvania and to Pennsylvanians. So do any one of you want to touch on what those are, including the enrollment periods, the different flexibilities, just touch on some of the benefits for us.
I'm happy to start and then have my colleagues jump in if that helps. So, Dave already touched on the impact of the reinsurance program on premiums starting in 2021. By our very creation, we've saved money and invested that in affordability, and as a result, premiums are going down. They're not just lower than they would have been, they're actually going down on average next year, which is a great initial first step and result of this transition. You mentioned, Dr. Johnson, different enrollment periods. Another great benefit of having our own marketplace is our ability to set our own enrollment periods, whether they're open enrollment or special enrollment periods. We have the ability to create policies and procedures around those sorts of things specific to the needs of the Commonwealth. So one of the things that our board of directors, which I'm not sure, Tia, mention that as one of her many job responsibilities and titles, but she's on our board of directors. One of the early things that the board did related to expanding the period by which people can come in and get enrolled is expanding our open enrollment period. Previously, it's been 45 days. This year, it's going to be an additional 30 days. It runs from November 1st, just 12 short days from now, November 1st through January 15th, 2021 this year. Do others want to jump in with other benefits?
Yeah, well, I tell you, Zach, you had discussed the special enrollment periods. With that, in the world that we have lived in before, Pennie, those special enrollment periods, there were times where we couldn't really control what special enrollment period would be created. So if you have a situation such as COVID-19, you may have seen that some states who had state-based exchanges had set up special enrollment periods for their citizens. And Pennsylvania did not have the ability to do that. And having Pennie will give us that ability to do things of that nature. So, it's always good when you can provide the flexibility and changes and serve the residents right here in Pennsylvania. And we get to take control of that. So that's one thing I wanted to throw in. I'll let somebody else go next.
I think it's really great that we have that flexibility. I think that the longer enrollment period is certainly going to benefit Pennsylvanians looking for coverage. I wanted to pivot a little bit, though, to ask Helen to talk a little bit about dental coverage. What is the dental coverage with the exchange? Is it how does that compare to the coverage that people had before? Is there any difference? And how does dental coverage relate to the ACA?
Yes, thank you. There are a lot of different options here, and I know we're talking a lot about Pennie and the state-based exchange, but I would be remiss if I didn't point out that we have a lot of options for dental coverage in other ways as well. When our state decided to begin the Medicaid expansion program, a lot more people became eligible for Medicaid as their health plan coverage, and that was something that from a dental perspective, allowed more children to get comprehensive coverage for dental, as well as adults to get some coverage. So when we're talking about dental options for, adults versus children, adults in our state, who aren't able to get coverage through their employer, and oftentimes we see situations where employers will offer medical coverage, but not necessarily dental coverage as an additional insurance plan. So what's nice, I think, with our situation and the state-based exchange using Pennie, that adults will be able to purchase standalone dental plans. So if you're looking for a place, and we hear that quite a bit from families, where we just need dental coverage, what do we do? That's an option for them, that they can go onto that state exchange, find insurances that are great for Pennsylvania, and get those standalone coverage areas. Adults who qualify for Medicaid, either under, the traditional Medicaid or Medicaid expansion population, will also, they also receive a dental benefit, and that covers, basic cleanings. It covers services like fillings and extractions, and there are even more involved services that are covered just through a certain process called the benefit limit exception process. So if something's deemed medically necessary, those are covered items that adults can get in Pennsylvania. And then children, of course, are still able to get insurance through their guardian's employer or their caregiver's employer. They're able to go to Pennie. Dental is a essential health benefit under the ACA for children. So that means that there are plans for kids available. Some of them are incorporated into medical and health plans. Some are offered as standalone plans. And then kids also have a really great benefit coverage under Medicaid in our state and our state CHIP program. So, we want to see a situation where we have very few uninsured children and adults. And so I think that we should, we have to make sure everybody sort of knows their options, that they're able to determine, do I qualify for Medicaid? Do my kids qualify for CHIP? Can I buy into CHIP? Okay, well, maybe I need to go to Pennie and see my options there. We've got this, it's really just a nice way that I think we're going to see this complete circle of coverage available for our residents.
Great, thank you so much. I want to ask now, I know we touched on the fact that people who are already using healthcare.gov, they're already in the system, they're going to get notifications about the change and be able then to access Pennie. Tia, your group has been working with those patients right now. We have Lisa Cox in our area who has been fantastic. She's so enthusiastic. I think that her enthusiasm is infectious, and we just love her, and patients love her. She really reaches out to people. But people who are already in the system, already have insurance, there's a program for that. But how are there any other plans to outreach to other areas? Because there's still people that are not accessing care that might be eligible. What is the team doing to try to bring more people into the fold and get more people covered?
So our sister community has expanded significantly. As I mentioned earlier, there are over 200 enrollment assisters across the state who are doing in-reach at community health centers to check with their existing population to see if they're insured or uninsured, but then also doing outreach to the community, to local organizations, to food banks, to those areas where we know underserved populations are, to give them information and provide them with information. They may not qualify for health insurance through the marketplace, but they may qualify for Medicaid, which was expanded through the ACA. Their children may qualify for CHIP. And the wonderful part about our community health centers is that we're able to provide care for those folks who are uninsured there as well, and work with them to get coverage.
It's awesome, exciting to know. And I know that there has been a lot of outreach, again, in our areas and others, but it is really refreshing to know that there's more renewed efforts to really try to reach, especially those served populations or difficult to reach populations. That really is excellent to know. So one of the things that Pennie is doing is addressing reinsurance. And so David, can you explain to us a little bit about what that is and the work that's being done there?
Sure. So reinsurance is it's like insurance for insurers. It allows insurers to price their products lower because it limits their exposure to the very high, unpredictable medical expenses incurred by members that they're covering. So this reinsurance will actually step in and take some of those claims and take care of those and remove those from the business that the insurance company has. So by some of the insurers need to build that financial protection, they can now provide medical costs or medical insurance at a lower rate. So reinsurance is something that truly helps with being able to keep costs down, and it does it by making sure that it takes some of those higher costing claims off. Now, this reinsurance is considered, it's an invisible program. So as customers enroll in coverage and seek care under their policies, they won't know that their claim had gone and been taken care of in some other way. So it is just something that happens in the background. And it's something that Pennie and the Pennsylvania Insurance Department are going to work together on. So first, I think you kind of have to think about, how is reinsurance even going to be paid for? How does that even work? So Pennie is going to use the money earned on premiums sold through the user fee and invest it into the reinsurance, As the cost of the premiums go down, the amount of money the federal government expends on tax credits to subsidize those premiums goes down. Then the federal government provides us the money saved, and we return it to the state and reinvest it in the reinsurance program to turn lower premiums for consumers. So so Zach, is there anything that you want to add about the reinsurance program?
Just that I'm so glad that you're here, so you could field that question instead of me. No, I think you did a great job of answering it. And the important point is it's as you mentioned, invisible to the consumer. It doesn't put customers in two categories of risk or cost or anything. Premiums are lower as a result of it, and that's felt market wide. It's not segmented one way or another.
So as I understand it, then the fact that we are transitioning from healthcare.gov and running our own insurance exchange, we're able to have some savings that we could put into that reinsurance program so that the cost is lower for Pennsylvanians. Is that correct? Great. So we have a question here from the chat box, and the question says, if we wait until January 15th to pick a plan, is our current plan under healthcare.gov still active for those 15 days? Someone want to take that?
I'm happy to take that. That's a great question. And so by virtue of extending open enrollment, that question very much comes into play. But the key dates here are to ensure, especially if you're an existing customer, to ensure continuity of coverage from December 31st through January, you need to stay enrolled and pay by December 15th for January 1 coverage. If you don't renew in time, or if you're coming in new and don't enroll until January 15th, that means you'll be starting your coverage, your plan year, on February 1st. So the key dates are get enrolled and pay by December 15th for January 1, and or get enrolled by January 15th for February 1st.
Great, thank you. We've got another question in the chat box, or the question here online, and it says, will plans through Pennie allow for care if you're out of state traveling, and how does that work?
So that's a great question, and I would say the key eligibility criteria for enrolling in a plan through Pennie is you need to be lawfully present in this country and a resident of the Commonwealth of Pennsylvania. So if you're a resident and you're traveling out of state, but your residency is in Pennsylvania, then you should be eligible to enroll in a plan. There are also, you can get very nuanced here, but a key consumer protection afforded to people purchasing plans through the marketplace through Pennie is the ability for kids to stay on their parents' plan up until 26. And so if you have a kid, if you're a resident of the Commonwealth and you have a kid away at college, they can stay enrolled in your plan through Pennie as well.
So Zach, let me ask you a question on this one. You weren't expecting a panelist to come at you with a question.
Well, so, I knew you were here, so
I think it hurt a little. I'll heal. No, but so in this type of situation, these Pennie plans, when it comes to health insurance, they're the same as your healthcare.gov plan. So if you go to vacation in Florida, and heaven forbid, you need to go to the emergency room, you would treat it just like your health insurance that you have, because that's what it is. It just happens to be through the state marketplace versus the federal marketplace. Is that correct?
That's right. Yep. So the commercial insurers that currently offer through healthcare.gov, all of them are maintaining their coverage options through Pennie, and in some circumstances, they're expanding their coverage options, the amount of plans that they're offering. And you're right. Yeah, I mean, the details of your plan are very important, but it is commercial health and coverage, commercial health insurance, and the networks that exist for the most part continue to exist.
Great, that's definitely reassuring. I have a follow-up to the previous question. So it says, so the follow-up, the current plan would be renewed on December 15th for January. And then the new plan would be selected by the 15th of January, which would start on February 1st, correct? Did I read that
Sorry,
correct?
is that in the chat box?
Yes. Mhm.
So to follow up on the previous question, the current plan would be renewed on December 15th for January, then the new plan would be selected by the 15th. Sorry. So if you're a current customer and you renew in coverage, the key thing is to pay by December 15th. If you pay by December 15th, your coverage will be renewed for January 1st, and it will continue throughout the year as long as you stay current on your payments. The nuance related to January 15th is if you miss that for whatever reason, you have more time to get enrolled. The only difference is that if you enroll between December 16th and January 15th, the coverage won't be effective until February 1st.
So if you started your coverage then on February 1st, then in the next enrollment year, you would just need to pay by December 15th so that you wouldn't have a gap in your coverage for January. Is that correct?
That's exactly right. Yep.
Okay, good. See if there are any other questions in the chat box. A question here is, can you explain Pennie's no wrong door policy? What is that and what does that mean?
Sure, yeah. So a great benefit of bringing the marketplace under state control is our ability to have now 2 state entities responsible for marketplace coverage and medical assistance and CHIP. So the Department of Human Services, the Office of Income Maintenance, they provide eligibility and enrollment services for CHIP and medical assistance. And as you know, Helen was mentioning earlier, all of the great pediatric and other dental services available through those programs, those programs are administered through the Department of Human Services. Pennie is now a new state entity. We have a responsibility and the ability to work with each other to ensure someone who comes to Pennie, who ultimately is deemed eligible for medical assistance, or vice versa, the other way, that person has a pathway to get into coverage. And so the idea of no wrong doors, you come to Pennie, you come to DHS, ultimately you have a pathway to getting into coverage. We've been working with the Department of Human Services to make sure that will work on the back end, on the technical end of things, and on the service end of things to make sure that someone comes to us with a question or comes to our website with a question about medical assistance or CHIP. There are answers there about the right way to get into coverage. So that's a great benefit of these programs. And you know, I mentioned our board of directors earlier. The Secretary of Health and Human Services sits on our board of directors and has the ability to provide input and direction in the way in which we collectively provide access to coverage, whether it's commercial coverage through Pennie or medical assistance or CHIP.
Mm-hmm. And the one thing that this also does, and Zach touched on this a little bit, it really allows for a better oversight and management of something called a Medicaid churn population. And that's some of the most vulnerable Pennsylvanians that we have. And those are folks that kind of through the year kind of transition between the different, you know, maybe they have a job that is paying more than what will qualify for Medicaid. Well, then they wouldn't qualify for that. Then they would go to the marketplace and then, oh, something changed. They could go back. This will allow for oversight and watch those folks too, so that they don't fall through the cracks.
Just checking the chat box here to see if we have any other questions. Let's see. Can we, any one of you, expand a little bit about how Pennie offers the financial assistance? I know that we touched on this is a place to go to get those assistance, but how is that provided, and how do consumers access that?
Sure, I can start. Pennie will offer 2 forms of financial assistance. The first is referred to as advanced premium tax credits, and what those are, what that is financial assistance on a monthly basis to help reduce the monthly premium. To be eligible for advanced premium tax credits, APTCs, you have to go through an eligibility process, and eligibility is based on your household composition, household size, and your household income. To give you a general rule of thumb, if you're an individual making roughly $51,000 a year or less, or a family of four making a little bit, roughly $105,000 a year or less, you're going to be eligible. You're more than likely to be eligible for an APTC through Pennie, some form of premium tax credit. The lower your income, the richer the monthly premium benefit will be. The other type of financial assistance is help for paying for cost sharing. They're referred to as cost sharing reductions, but what essentially they are is if you enroll in our silver tier products, we offer 4 types of products: bronze, silver, gold, and platinum. If you're eligible based on your household income and you enroll in the silver plans, you get further assistance to pay for your deductible, copay, co-insurance. And in some cases, we, on the lower end of things, we offer very, very low deductibles. Does anyone want to offer anything else there or expand upon the consumer experience?
Okay, great. You just check for some other questions here. So in this era of COVID, I think that all of us are very cautious in terms of our exposures. And so that, outreach in the past really was door to door, going to community events, meeting people out in the community. So now that we're a little restricted from doing that, and we really are trying to social distance and decrease the spread of COVID, how then can we reach people? Is there a virtual option, or what other things are we doing to modify our outreach?
So yes, COVID-19 has really thrown us for a loop, but our community health centers have adjusted and adapted tremendously. They've just really gone above and beyond. Sisters are able to provide enrollment assistance both virtually and over the telephone. So this allows consumers to remain safe and at home and get help in their own living rooms. So staff, of course, are taking all the necessary precautions and following state and CDC guidelines for those who still want in-person assistance. And there will be additional outreach events. And there will be folks who want to come to those outreach events, and sisters and other folks, boots on the ground, will be in the community, and they'll be providing assistance, but with all of the precautions needed.
And I think Tia covered this, but just so that everyone listening is really, really aware, all of the help that these assisters give is free of charge, correct? So anyone who needs help, whether they're not sure what kind of insurance they qualify for, or whether, they had one insurance and maybe need to move to a different, the assisters would be able to help with that. Is that correct?
Absolutely. Our sisters are not only trained on health insurance marketplace and the rules and regulations of that, but also on Medicaid and on CHIP and different aspects of Medicare. So really at our community health centers, we're a medical home, and we try to be a one-stop shop. So making sure we have those resources available and the knowledge to get folks where they need to get is one of the things that we make sure we pride ourselves on, and we make sure we're able to make those connections.
I know one of the concerns in the past had been just the availability of that assistance. And do I understand it correctly, though, that in the transition from healthcare.gov, some of the flexibility that we've achieved made us able to broaden that outreach and provide a more robust service than even we were able to have before. Is that correct?
Absolutely. Over the years, funding has been reduced significantly. And with Pennsylvania taking on our own marketplace, we've been able to really hone in and focus where dollars need to go. Advertising, social media, boots on the ground, making sure that folks who are in the community and wherever they live, shop, play, pray, wherever they go, they're able to get information at the grocery store, at local libraries. You know, there'll be flyers and all kinds of information available. And in the past few years, we really haven't been able to get that advertising and get the word out the way we wanted to. So this is a milestone for Pennsylvania, and this year, folks will be able to see the impact of making Pennsylvania a state-based exchange.
I would just like to offer or applaud the work of those that provided that in the previous years, the work of Tia and PAC and Lisa Cox and others to provide that in-person assistance, even when there wasn't really a lot of funding coming in. There's a lot of people across our sister network who were just providing enrollment assistance because they knew it was necessary and were not receiving federal dollars to do it. And so there's a great benefit of this new program in our ability to put more resources out there, but I don't think we should lose sight of the great work of all the people who did that without getting paid for it, just because they knew it was the right thing to do.
It was an unbelievable experience to work with all of the folks that did everything they could to try to get people enrolled, from libraries to the health centers, everything that Tia's team did. It was unbelievable. I know for one, I am so excited to see what Zach and his great team and Tia and her great team and just everything that we have going on, to see what kind of room we can make with getting more and more Pennsylvanians insured. It's exciting.
Yeah, no, I definitely agree. The team has been, as I said before, just very passionate, and their enthusiasm is obvious and has been really quite contagious. I just wanted to ask, I think that now that we are doing a lot of things virtually, and I think the whole population has gotten a lot more tech savvy. Is there a way then to access Pennie through an app, or any other way to do that on your mobile device, or other ways like that?
Yeah, so our website is mobile friendly. The ability to enroll in coverage, you can do that through a tablet, or the application takes a little bit of time, so you can do it through your phone, but I would recommend using a tablet or on a computer. But it is mobile friendly, it is tablet friendly. We try to make ourselves, particularly in this environment where the ability to get in-person assistance is a little bit harder, and you have to be a little bit more safe than you were in previous open enrollment periods. We are trying to make ourselves as accessible as possible. So we also have, we've already mentioned, we have a dedicated call center with customer service reps who can provide customers, consumers, as well as brokers and assisters support through the process, through the enrollment process, through the application process, through the choosing a plan process. That's a resource that's available remotely, of course. And of course, our website will be available 24/7.
Great. So I know that each of you, I think there might be areas, questions that we didn't ask that we think that the viewers might want to hear. So I'll ask each of you to spend a few minutes just catching up on anything that we might not have asked, but that might be important to the consumers. And I'll start with you this time, Helen.
Well, thank you. And we do, as a coalition who handles a lot of communication around dental issues and dental concerns for the state, we do tend to get a lot of questions, people seeking either providers or having questions about teledentistry. That's something that we've been hearing a lot more about this year, of course. But one of the bigger sort of issues I think that we hear more often than not is really dealing with pregnant women seeking coverage and extremely young children. So I did want to just point out for any of the listeners, and some people are aware of this and not all are, that, we do have Medicaid coverage for pregnant women in Pennsylvania. And it's something that actually follows them through pregnancy and is available until 60 days postpartum. And that includes, of course, their dental coverage as well. So under with the COVID-19 pandemic happening, we also have sort of a caveat happening right now where under the Families First Act maintenance of effort clause, that we can't pull back any coverage for individuals who have it until the public health pandemic has been ended. So, I think that's extremely important for the postpartum population, young mothers, who maybe will be able to maintain some of their coverage a little longer than they would have been otherwise. And that's something that, from the perspective of getting families into care and establishing a medical home, a health home that includes dental care as well, we want to see a situation where moms are covered, they have the coverage through their pregnancy, they maintain that coverage in the postpartum period, and then that leads directly into the coverage for their families. So it's something that, it's almost like an ideal health situation where we see this coverage that lasts through. Some of the other issues we see, both from a medical and dental perspective, I think, and as was touched on a little bit before, is the folks that come on and off of coverage and have, almost too many choices. So, I think that through the Families First maintenance of effort clause, we're going to see a situation where people can kind of maintain that coverage a little longer and maybe see some more consistency. But definitely want to point out that, from the dental perspective, pregnant women are covered for dental services and definitely should seek that care to make sure they're as healthy as they can be for themselves and for their babies. That's the one big question we get quite often.
Great, thank you for addressing that. One thing I wanted to come back to, as we know the enrollment periods as they are, what happens then with someone who loses a job and loses coverage? Can they access the system in between enrollment periods? How does that work?
Yeah, that's a great question. And that was going to be, jumping ahead, that was going to be my other thing I wanted to put out there, was how do you get covered outside of the open enrollment period? And so that's a great example of a situation where, essentially circumstances created a event where you're losing coverage outside of the open enrollment period, right? So generally speaking, when those things happen, like losing coverage through losing your job and losing your employer coverage, that triggers what's called a qualifying life event. And that gives you the opportunity to enroll through the marketplace, to enroll through Pennie, through what's called a special enrollment period. And that is, generally speaking, 60 days. It gives you a 60-day window where you can come in and get covered and work towards achieving continuity of coverage. Now, losing your employer coverage is an example of that. There are others. For example, if you experience a household change, if you have a kid, or if you get married, or if you get divorced, that's a qualifying life event, and that allows you 60 days to get enrolled in a plan, get your child enrolled, get your family member enrolled. If you move to the state, or if you move from one region to the state to another, that triggers a qualifying life event. There's a series of these, and so I would generally speaking, if you're experiencing a big life change of some kind and you don't have coverage, take a look at your options. It doesn't hurt to come to us. We'll run you through a process of determining if you are eligible for a special enrollment period, if you've triggered one of those qualifying life events to get covered. So when in doubt, check us out. Come see us at pennie.com, pennie.com, and we'll see if you can get enrolled in coverage.
I'm muted. Is there a list of those qualifying events on the Pennie website that people can access themselves?
There should be, it may not be fully populated in our FAQ, but it will be, and there are common ones, and then there are less common ones. So if you're not sure and you don't see it on that on our website, you should also just ask, because there are some very not so common qualifying life events that also apply.
Great. Before we move on, there's another question in the chat box. Will there be an option for vision coverage?
So we do not offer vision coverage. We offer qualified health plans and qualified dental plans. Vision is not something that we are actually allowed to offer on the marketplace. It is something that we want to explore if there are, particularly through our partnerships with different types of brokers and producers that offer a litany of insurance products, if there are opportunities to offer vision coverage in the future, but that is not something that will be available this open enrollment period.
May I ask a question to follow up?
Sure.
The panelists can ask questions too. Are there any plans, and you may not know this, Zach, so I apologize if I'm catching you off here. Are there any plans that have sort of a vision rider or dental rider that are already like as part of the main health plan? I know that there are services and other, commercially available insurances that will maybe not necessarily have a vision policy or a dental policy, but they have sort of a little rider that helps to pay for some of those services as part of the overall health plan. So I don't know if you're aware if there's any of those types of available options through Pennie.
I don't. I will say that those wouldn't be directly available through Pennie, but to the extent that you would get enrolled with your commercial insurer for either health or dental, those arrangements may exist directly at the insurer. So, we are a piece and a step in the process. We will connect you to commercial coverage. We'll connect you with financial assistance. We'll answer all the questions we are allowed to and are able to. And if we don't know them on the spot, we'll go figure it out and answer them for you. But we also connect you directly to the insurers for questions about your claims or, very specific questions about what the product covers and what it doesn't cover. And it's quite possible that some of the insurers have those types of rider type benefits, but I appreciate the question. I don't exactly know directly the answer, Helen.
Great.
As a panelist, I have a question as well. Is that only for adults for vision, or do children's policies cover vision as well?
We are required to cover essential health benefits. The 10 essential health benefits are required to cover pediatric, dental, and I am not sure about vision, but I think it's just dental. I don't know, Dave or Helen, if you know off the top of your head.
Not off the top of my head.
All right. Tia, are there some other things that you wanted to mention that we didn't get around to, that didn't come up in a question?
Absolutely. Just want to remind consumers that pre-existing conditions are not counted against you. And there are no lifetime limits on coverage. So those are things that have been in the news lately, and folks may not be clear. But as of right now, pre-existing conditions are safe and there are no lifetime limits on coverage. And also for folks who need assistance and they're looking for an assister in their area, we do have a toll-free number. And that's 1-866-944-2273. And we can assist you with finding an assister in your area. You can also go to PAC's website, which is www.pachc.org. And there are lists of assisters there as well.
Great, thanks. And we are going to have those resources listed on the CHIC website, right? So that people can access and can navigate from there, because a lot of great resources have been shared. I think I heard earlier that, there is concern about the Affordable Care Act. It has been highly beneficial to many Pennsylvanians, and a lot of people are using it and have coverage because of it. What I heard then is that even if there is some uncertainty about it for the future, it is coverage now, and so that you should enroll. You're going to have coverage in January, and likely have coverage then through 2021. So don't, if even in the uncertainty, just go ahead and make sure that you get your coverage. Is that accurate?
That is accurate. And in regards to the question earlier about the pediatric oral and vision care, that is part of the 10 essential health benefits.
Great.
Thanks, Dave.
Okay, thanks for that. I think, so David, are there other things that you might have mentioned, things that we didn't ask or didn't cover?
I think the one thing that I want to make sure folks know is that they are not alone. As they are trying to navigate their way through the health insurance marketplace, they don't need to do it by themselves. We have great folks at Pennie. We have great folks as navigators and assisters, Tia and her team. And the insurance department is here to guide you if you get lost. Don't be afraid to reach out to us if you need just that extra phone. Where was I supposed to call? We can help you with that, okay? So just, you are not alone. You don't have to do this alone. There's free assistance out there to help you. And please be sure to take advantage of it. And there's tons of information on the insurance department's website as well, talking about insurance and how insurance works and what are copays and co-insurance and deductibles and all that kind of great stuff. So be sure to check out some of those videos that we've created to kind of help you navigate the purchase of insurance as it comes up. So that's all I really have. So I'll put myself back on mute.
Great. So yeah, I think important messages that I got from this for consumers is that, if you don't have coverage or you're transitioning from healthcare.gov, go ahead. The enrollment period starts in November 1st. Payment by December 1st gets you in so that January 1st you're covered, and there's not going to be a gap in your coverage. Don't worry about the uncertainty. Make sure that you secure your coverage now, and that there are a lot of subsidies that are available for people, and the assistance to figure out what plan is best for you as an individual is free and available out there. And so that if you've got questions, you can reach out. There are a lot of resources to reach out to, and there's not a charge for you to get that information. Is that correct?
Yeah, that's right, Dr. Johnson. The only edit I would have is you have until December 15th to enroll and pay for January 1 coverage. And if you don't meet that, there's still time after that through January 15th.
Great. There was a comment in the chat box that this has been really helpful because this is just confusing for many people. I think that there is concern that healthcare.gov is going away, and not realizing that in that transition, it's been really thoughtful in terms of what consumers might need, and many of the services have been enhanced and expanded to really meet that need. And so that the transition should be easy for people who are already connected, and easy to reach out to those who aren't connected now. So if someone has a question then about Pennie or how to get insurance, the the ways they can do that is they can go to the CHIC website. There's going to be information there. They also can see this program. It has been streaming live on Facebook, but they also can access in different ways, and that will be on the CHIC website. It also will be on the final slide. And then people can go to Pennie directly. They can also inquire at their health centers as well. But there are direct numbers to access that information. Are there other things that we think consumers might want to know that we didn't cover, or didn't mention from any one of the panelists?
One thing I wanted to add is that it's important to have coverage, but it's also important to use that coverage to get care. You don't want to have an insurance card in your pocket and be sick. You definitely want to use your cards and the resources available to you to get care. We call that from coverage to care. Preventative screens are included in ACA compliant plans, so folks shouldn't worry about that either, but just make sure you're taking care of your health from coverage to care.
Oh, that's a great point. Very well taken. I think that most people know that preventative care does pay off in the long run, not only for the system, but for the individual. And so that getting your preventative services can prevent a more severe condition that costs more to take care of, but causes more disability and pain and suffering. And so getting signed up for coverage, this is not meant to just cover you for something catastrophic, but, get all of your preventative screenings, find out if you have a condition that needs to be managed so that you could decrease the disability that comes later on. So really great point, Tia. Now that people have gone out and gotten coverage, use it to keep yourself healthy and prevent disability later on. Great point. Other things that we might not have covered or might need to address. I don't see any other questions in the chat box yet, but just a reminder to those who are out there participating, we're open for questions. Any question that you have, even if we have covered it partially, we're here to make sure that we answer your questions. Zach, did you have something? No.
I don't have anything to add. I would just underscore the point that you and Tia just made about accessing preventative services. It's so very important to go see the doctor, your primary care physician once a year. It's covered under the plan at no cost. I am someone who benefited from having a strong mother who told me to go to the doctor when I was growing up, and even when I left the house. Not everyone has that, has a mother who tells them what to do all the time, but just go see your doctor. Just go access your preventative services from time to time. It's so very important.
Great.
And I would just, we hear from a lot of the different provider groups that we work with that, and I think this was touched on a tad around with the COVID pandemic. We did sort of have a little bit of a small period there where we weren't really seeking out those preventive care services, and we weren't looking for, all of our regular oil changes. And, now is definitely the time. We've seen a decrease in a lot of different preventive care, things that typically, things like children's vaccinations are down 20% plus. Dental care for kids is down almost 70%. So, it really is important, I think, to remind everyone, that we've got to make sure we continue doing those maintenance kinds of things that we need to keep ourselves healthy. Because that's really how we're best going to fight the pandemic, is staying nice and strong and healthy and having a good immune system. So, all of your care providers are ready and they're equipped to see you. So I think it's just really, really important that if you have missed any of your regular checkups, that, now is the time to get those scheduled. And you can still expect that some providers may have a little bit of backlog whether it's personally or professionally with the groups we work with, we're still hearing that there are some waiting lists. So, even if it's something like scheduling a mammogram or scheduling your child's dental visit, it may take you a month, 6 weeks, 2 months to get into an appointment. So it's really, really wise to take care of that now and make sure you're staying on top of it. The end of the year is always sort of a fun, interesting time for coverages like dental insurance, because that's when everyone says, oh my gosh, I didn't do all those things I wanted to do. I want to get in and get them done. I've got to use up my insurance for this year. And so it's really, you don't want to wait until December 15th to do that. You want to make sure you're doing that now, knowing that because of the pandemic, appointments are taking a little bit longer. Providers are taking more precautions. And so it's wise to make sure you stay on top of that.
Great, thank you, Helen, so much for mentioning that. Yes, you're right. All across the country, preventative services took a huge hiatus, and so that children weren't getting vaccines, adults weren't getting their screenings, but certainly not. This is the time to catch up. As you mentioned, providers are taking precautions, and so that they're taking precautions to keep their staff and patients safe. So it is safe to go in. There are some services that can be managed virtually, and so certainly take advantage of those as you can, but there are definitely things that are needed to be done in person. As we said before, don't avoid that preventative service that can really avoid a more serious problem later on. So yes, great. Thank you so much for mentioning that. Other things that consumers need to know about Pennie or about their health, or as my panel here have become moderators, what other questions do you have?
Dr. Johnson, can I add another thing?
Yes.
So we've spent the better part of this last year effectuating this transition, trying to take as much input and stakeholder feedback about how to achieve the goals of a good quality customer experience and a seamless transition. And so we're coming up to launching this thing and making that transition. But I want to offer that this is the end of the beginning, as they say. And we are not going to get it all right on day one. We really want to hear about different ways in which we can improve our service, improve our policies, better make good on the goals of quality service, expanded access to coverage. So there's a number of ways in which we seek to secure that feedback. You can go to our website. We'll provide the right place to provide feedback. We have web forms online where you can provide information, feedback to us. We also have a couple different monthly stakeholder work groups where we get on, we provide feedback, input on where we are, what we're up to, and to specifically secure stakeholder input on how we can do better. And there's one work group focused on brokers. There's another focused on outreach and education. They're both pretty good places for getting the word out, but also securing feedback. So there's a place on our website where you can go there to sign up to be on those distribution lists and to join those work groups, and we'll make sure to share that information broadly with this group and others.
Great, excellent. Well, I think we're coming to the close of our time here. I really want to again thank our panelists. You guys have been great. I think that there's certainly people who want to get more complete information, and I think this has been helpful. It's been educational for me as well to understand more about what's available in this transition that we're in. So I think exciting that we've got more flexibility, that we are able to impact costs with this change, and so that more people can be covered at a coverage that's affordable. So really, really great to know. Thank you, Chick, for organizing this. Thank you, Lisa, as well. I'm going to turn it back over to Paula or someone from Chick just to close us out and give us access to the resources that are available.
Hi, thank you, Dr. Johnson, and thank all of the panelists. That was really wonderful. We all really appreciate the time and expertise you shared with us today. It's really been quite an informative discussion, so thank you so much. And I also want to thank all of those of you who submitted questions. As mentioned earlier, they'll all be answered, including the ones that the panel didn't have time to get to today. And we're going to post them at crawfordcountypartnership.org. The website addresses and contact information is showing on your screen here. And as Dr. Johnson mentioned, we'll gather all the other resources that have been mentioned during this discussion and post them there as well. You can also visit crawfordcountypartnership.org to find a link to the recording of this event. There'll also be dates when this program will air on Armstrong Cable, and links to all resources offered by the panelists I mentioned, including their contact information. I do want to remind people that it may take about 24 hours to post the video. I want to thank everybody for your time today, and hope that you've gotten some useful information. And if there's nothing anybody would like to add, we'll leave the information screen posted here for the final few minutes, and I'll close out by telling you all to take care and have a wonderful evening.
Great, thank you all. Thank you to our panelists. Thank you, Paula. And everyone stay safe.
Thanks so much.
Thank you.
Thank you.